Thank you.
Resuming debate, the Honourable Member for Vancouver East.
Thank you very much, Madam Speaker. And first of all, just let me say that I'll be sharing my time with the member from Beauharnois-Salaberry. Madam Speaker, I'm very pleased to participate in the debate today on this very important motion, and I thank the member from Toronto Centre for bringing forward this motion. The NDP does support this motion wholeheartedly, and we're very glad that there's a thoughtful debate taking place in the House of Commons today, which is something that we can't always say, that we have a thoughtful debate. This is a very important issue, and I know that many members will contribute to the debate today. I listened very carefully to the Parliamentary Secretary for the Minister of Health in his comments, and while I appreciate that he told the House what it is that the Government of Canada has been involved with, I really feel that there was a lack of information. It seems to me that the debate today, particularly for the Government of Canada, is an opportunity for some reflection, not just about what they think they're doing, but reflection about what's not being done. I didn't hear that in the Parliamentary Secretary's speech today, which was, I have to say, disappointing, because today is a day where I think all sides of the House are actually willing to hear that kind of debate. Like, let's actually hear from the government about where they think they're not doing enough, and let's have them ask the House to support a greater effort about what needs to be done. Presumably, we're having this debate because there is a great sense that there's a crisis, that the Government of Canada and all of us, and I think the member from Toronto Centre made this point, it's not just the government, it's all parties, we have not done enough on this issue. And so I wanted to begin my remarks that way because I hope that other government members will actually be more reflective and put on the table and make part of the debate about what the Government of Canada, from their point of view, needs to be doing in a better way. And one of the things that I would draw attention to is really the underlying risk factors. The fact is there have been many studies done on the prevalence of suicide, groups that are at high risk, and we've heard of some of that in the debate today, whether it's Aboriginal youth, whether it's in the north in small remote communities, but there's also other demographics and populations that are at risk, like LGBT community, veterans, seniors. I mean, there's so many studies that are being put forward, but it seems to me that we don't pay enough attention to some of the underlying risk factors. And the fact is, suicide is preventable if one understands what's taking place, whether it's from a personal level in terms of someone who may be suffering from depression and mental illness, whether it's someone who has gone through some sort of trauma and tragic circumstances, but there are also bigger societal and socio-economic and social conditions that are in effect. And I think we've seen this so many times in our country. How many times have we turned on the TV on a particular channel and seen just the most tragic story of a string of suicides that's taken place in some small community? I mean, surely that's got to be sending off the alarm bells, that there are social conditions in this country to do with poverty, to do with isolation, to do with lack of educational opportunities, to do with overcrowding in housing, lack of the basic necessities of human dignity for life. Surely these are some of the assessments and the risk factors that we should be looking at. Another one would be stigma. I mean, again, if one looks at lesbian, gay and bisexual youth, we know that they are at a much higher risk for attempting suicide than heterosexual youth, 28% versus 4% according to the Crisis Intervention and Suicide Prevention Centre of British Columbia. I mean, these statistics, Madam Speaker, are very, very alarming. So I really feel that in this debate today, and the motion talks about a strategy and setting up a fund, we've got to understand and grapple and come to terms with some of the underlying risk factors that are operating within our country. I mean, we think of Canada as this incredibly wealthy, place of opportunity, a place of incredible resources, great cities, you know, a great environment, and yet we do have these very alarming statistics. And I think we have to ask ourselves why it is when we have a society where the gap is widening between people who are doing exceptionally well and people who are being left behind, people who are living in poverty. So, Madam Speaker, I really hope that in today's debate we can focus attention on some of those issues. I know that my colleague, the member from Halifax, just very recently tabled a bill, Bill C-297, which is an act respecting a national strategy for suicide prevention. And this is a very excellent bill, Madam Speaker, and the government would be well advised in supporting this motion to look at this bill and to incorporate the ideas that are in the bill, because the bill clearly lays out the need to ensure that there is access to mental health and substance abuse services, and that we do need to reduce the stigma associated with using mental health and suicide-related services. The bill also talks about the need to establish national guidelines for best practices in suicide prevention, and to work with communities to use culture-specific knowledge to design appropriate policies and programs. Now, that, I think, is a very important element. There's not a one-size-fits-all. It's a matter of understanding what's going on in a particular community, whether it be in a geographic sense or whether it be in a demographic sense, to understand those cultural-specific risk factors and issues that are at play. The bill also talks about the need to the coordination of professionals and organizations throughout the country in order to share information and research and to support our healthcare professionals and our advocacy groups who work with individuals who are at risk of suicide. You know, Madam Speaker, I was on a Via Rail train just a couple of days ago and picked up the magazine that was in the pocket in front of me and was just looking through and was surprised to see a major feature in the magazine about suicide. And it focused on the risk of suicide as it affects students, particularly those who are in an environment where the stress of academic excellence is something that produces an enormous amount of anxiety and possibly depression. This particular article focused on a number of deaths by suicide that had taken place at Queen's University, and that's where I actually happened to be going to speak at a human rights conference. And I thought it was quite remarkable that in a Via Rail magazine on the train, here is a major article about suicide, and particularly focusing on a population in our society that we often think, well, those guys are doing all right. You know, these are students who are motivated. They have all kinds of self-esteem. They're doing really well. They're the elite, and this is the future of our society. So it was really quite shocking to read the stories of what had unfolded, and this is just one post-secondary educational facility, and to see the trauma and the impact of the tragedy of a number of deaths that had taken place in the life of that particular university. And I don't mean to single them out, because I know this happens elsewhere as well, but it just happened to be the focus of that article. And it was truly shocking, because I think it brought to the attention of all of us that this issue of suicide, as it relates to mental health and well-being, is something that is very prevalent. And so the statistics that we see, 10 people every day who commit suicide, again, is something that's very alarming and shocking. So, Madam Speaker, I want to say that for those of us in the official opposition, the NDP, we see this issue as a national priority. We're very happy that the member for Halifax has introduced a private member's bill, and it's a very comprehensive private member's bill that gives us the guideline and the framework for what we need to do to bring forward a national strategy. So, Madam Speaker, I'm going to end by coming back to the Government of Canada. Let today be a day where we all participate in this debate, and rather than only describing the problem, let us focus on what needs to be done, and let the government members think about what they are not doing, what they haven't been addressing. Why is it that so many Aboriginal communities are living in third world conditions? Why the suicide rate is so high in small northern communities? Why this is an issue that affects our youth, the LGBT community. Mr. Speaker, these are the things that we need to talk about in order to come up with an adequate national strategy. Thank you.
Comments, the Honourable Member for Scarborough-Agincourt.
Thank you, Madam Speaker. Madam Speaker, we talk about people that commit suicide, and these are the people that are distraught and way down at the bottom of the barrel, one can say. However, one of the things that we also should be thinking at the back of our heads and we should be addressing are the people that are committing suicide but are not doing it voluntarily and are not even cognizant that they're doing it. And these are the people that are sometimes go out and drink, and then they take drugs that compound their speed, their need to get high, and some of these people also through that means commit suicide, not wantingly, not knowing. So I was wondering if the member would also be able to address the fact that a lot of people overdose, a lot of people are drinking and also taking prescribed pills in different parties, and if we should also somehow through our strategy that we're talking about creating here today, we should also make sure that we also address that particular issue.
The Honourable Member for Vancouver East.
Well, Madam Speaker, I thank the honourable colleague for his question and his comment, because I think he's entirely correct that there are broader and bigger issues as well related to suicide. I certainly am very involved in my community where the issue of people who are facing addictions, often because of trauma, it's often an issue of self-medication. It's often as a result of being on the street, of being homeless, or having come through residential school. And so, again, this is the point. We see these communities that are at incredibly high risk for a number of factors, and it may well be that somebody makes a decision to end their life. It may be a situation where the behaviors that they engage in and the lifestyle that they have are leading them to a very early death that, again, is preventable. So the question we have to ask ourselves is not only what can we do on an individual level, but what kind of strategy can we put in place to address these underlying issues and risk factors that are so preventable. If we provided the resources for housing, for education, for proper counselling, for follow-up, I think we would decrease the number of deaths.
Commentaire.
Comments?
Member for Kitchener-Conestoga.
I want to thank you again, Madam Speaker, and I want to thank my colleague for her intervention. And again, just to highlight the fact that we're having this conversation in a national forum like this is so important. It's important that we stop the silence, end the silence around this topic. I want to commend previous questioner who commented about my colleague David Batters, and I also want to take this opportunity to thank Denise Batters for her amazing work in sharing her story, of not being afraid to share her story and bring this out into the public forum. As you know, my colleague Dave Batters was very open about his battle with depression. For many of us, it was a total shock to hear that he had ended his life by suicide. He was always such an encouragement, a great person to be around. But I think my colleague will agree that not all suicides are the result of mental illness, and there is, as is pointed out in the motion, a public health issue here as well. I wonder if my colleague would just highlight what her understanding is of the need for a public health part of this in addition to the mental health part. Thank you, ma'am.
The Honourable Member for Vancouver East.
Well, thank you very much, Madam Speaker. I'm glad that the motion was framed as well as a public health issue, because I think that allows us to examine the broader aspects in terms of awareness and stigma and under education that needs to take place. And what a familiar story and a sad story that when we learn of someone who has taken their own life, people will often say, wow, I didn't know, or I didn't realize what was going on. And so I think the element of broader public understanding, both within a, an immediate sense within the family or within the school system, but for all of us, whether we're colleagues here in the House, whether it's in our local communities. I mean, this is such an important element because there unfortunately still is so much stigma that's associated both with mental illness, with depression. And again, I think this is why today in the House it's really important that we urge the Mental Health Commission of Canada and the Government of Canada to focus on a specific strategy that deals with suicide prevention.
Prise du débat.
Resuming debate, the Honourable